How are you guys all doing today? Welcome to another amazing episode on my YouTube channel. Please, if you're just joining for the very first time, please like, please subscribe, and please drop a comment at the comment section below. And if you are among my amazing returning subscribers, I want to say thank you all so much for the encouragement, for the love. You all are amazing. You guys are so wonderful. Thank you all. My name is Mercy Asimole. I am a clinical dietitian. I am a food doctor. I am also a doctor of dietetics. Either one, you all are correct and you are welcome. All right. Without wasting much time, let's dive into the topic of today. Now, today I'll be talking about why should a diabetic patient eat bread, or should a diabetic patient eat bread? That's a lot of questions persons, especially people who are being diagnosed of such condition, have been asking. Some of them have been doing some things that are wrong. Some of them have actually been trying their best. Okay, now first of all, I will tell you what diabetes mellitus actually is, so that you understand what it is. Now, diabetes mellitus is a chronic metabolic disease that has affected how your body uses glucose, that is sugar, for energy and other metabolic activities in the body. Now, for persons who have been diagnosed to have diabetes, their body cannot utilize this sugar because the pancreas, which is responsible for production of this insulin, has been affected either by any factor. Now, they cannot be able to utilize the sugar they eat. It cannot be properly broken down so that it can supply the energy they need. Now, for example, just like now you eat your rice, your beans, these things are being converted to glucose for energy to the amount of quantity that your body or your cell will need. Now, for the diabetic patient, it is not actually being processed very well. So these things go, so they actually go to their bloodstream directly instead of being reduced or being acted upon by this hormone, so that they can be easily absorbed for energy and other activities. These activities are not done if someone is being diagnosed of diabetes. Yes. Now, someone who is being diagnosed of diabetes doesn't mean that they can't eat bread. Trust me, if you have diabetes, if you know someone who have been diagnosed of diabetes, they can actually eat anything. They can eat anything. Now, the problem we have nowadays is people don't actually go to the right professionals to give them informed guidelines on how to go about their health. You cannot tell me that you're trying to manage diabetes and you're going to a gynecologist or you're going to a physiotherapist. No, if you're trying to manage these situations like this, you need to go to a registered clinical dietitian that will actually help you manage the disease condition or the health condition to prevent further complication. Now, to the answer to the whole, like the conclusion of the whole thing, a diabetic patient can eat bread. Now, it depends on the quantity. If you can take at least 2 to 3 slices of bread per serving is fine, because most persons think that since they're already diagnosed with diabetes, all the things that are bitter, all the bitter thing in the world is for them, because they feel when something is bitter, it's to help my sugar level to be stable. No, even if it's as bitter as anything, it will not even touch your sugar. Your sugar, is if it's high, is going to still be high. So it's just understanding basic principles on how to go about this thing. You should not self-manage, don't self-medicate. Go to the right health professionals, go to the right health practitioners to help you make informed choices. Now, the thing with diabetes, actually, the things they should do is to focus on quantity control. That is why you need to meet a dietitian. It is not for a medical doctor. Even if you are taking your insulin drugs, your hypoglycemic drugs, your insulin injection, and you are not paying attention to the kind of things you put into your mouth, it is like pouring water on stone. Your sugar can even go more than 500. So that is just the basic principle. So it is very important to put quantity to check. Now I usually tell my patient that if they want to have each meal a cup, just like your normal local moi moi, your beans cake, just that normal cup you use for it is an ideal quantity for maybe you want to measure your rice, your beans and all that. But for vegetables, you take them liberally. Not all food should be consumed according to blood sugar. So these are things you need to check. You need to check the kind of quantity of food you eat. You need to check if your exercise is in order, if your stress is in order, if your vegetable is in order, even your water consumption. So now I am telling you this, that either if you're diabetic or any disease condition, you can eat anything except there is a serious restriction. Then they will tell you, okay, do not eat this, because your body needs all it can get to be able to function properly. That is why it's good you meet a dietitian, so that they will make a menu plan for you that will suit that particular disease or medical condition. It is very, very important. So as a diabetic patient, you can eat bread. It's not about the wheat bread. It's not about some people go to take herbal drugs because it's bitter, it's going to drop their sugar level. You are killing your kidney, you are killing your liver. It is not about that. Meet a dietitian to give you the information you need according to your age gap, because there's what you call recommended daily allowance according to age. According to your age, so that it will help manage your disease condition. So I know I have answered this question that a diabetic patient can eat bread, but the quantity of bread you eat matters a lot. The quantity of whatever you put your mouth matters a lot. It is not about eating plantain. Some people say plantain reduces sugar. Even if you like eat plantain from now till next year, it will not still affect, unless you know the basic principles on how to properly do what you're supposed to do. So everything depends on you. Everything depends on the health practitioner you come in contact with. I actually advise patients with such disease conditions to actually have a personal dietitian to guide you on things you do. Even as you're taking your drug, you're not doing the right thing. It's just like you're pouring water on stone. It will not be effective. So let's meet the right health practitioner to help us manage every medical conditions we are having, and you will be so happy because it will prevent complications. And once these complications are prevented, the process become reversed. You see somebody that is having high blood sugar, it will just drop to normal because you're doing the right things. Now it has been proven that everything is not longer dependent on your drug, because you cannot tell me that somebody is going to take drugs without eating. You need to eat before your drug can work. So you see that it's dependent on your drug and your lifestyle. It is very, very important you pay attention to the things you put into your mouth, because the things you put into your mouth, it is what you become. Alright guys, without wasting much of your time, I'm gonna say thank you all so much for joining this section. Please hit the notification bell below for more and interesting videos. Please, if you have questions on a topic you want me to address, you want me to treat, you want me to talk about, please do not hesitate to drop it at the comment section below. Alright guys, bye for now.